Hello everyone, I'm Ying Hao, student number P121480, majoring in educational psychology. The main topic of today's presentation is case study methodology in qualitative research. Before I begin, I would like to introduce you to the main content of this presentation. Firstly, I would like to give you a detailed introduction to the case study method, including its definition, characteristics, and use. After this, I will start with a paper that uses the case study method and by presenting how it was used and the final results. I hope to give you a deeper understanding of the case study method as one of the qualitative research methods. So now, I'll begin this report. Okay, let's start with the method itself. About the case study, I will introduce it in 6 dimensions. Let's see a brief summary first. These 6 dimensions are the definition of the case method, his 4 important characteristics, his 6 types, the 6 data collection methods of the case study, and the 5 data collection methods. Of course, I also have a few good reference books for those of you who want to study case studies in more depth. Okay, let's start by looking at what a case study is. A case study is a research method for the in-depth study of a person, a group, or an event. It is a research method in which almost all aspects of the life and history of the subject are analyzed in order to seek patterns and causes of behavior. Because it is a research method with depth, so it allows researchers to investigate things that are often difficult to replicate in the laboratory. It allows researchers to gather a large amount of information. It gives researchers the opportunity to gather information on many rare or unusual cases. It allows researchers to formulate hypotheses that can be explored in experimental studies. There are roughly 6 types of the case studies, which are collective case studies, descriptive case studies, explanatory case studies, exploratory case studies, instrumental case studies, and intrinsic case studies. We also know that both qualitative and quantitative research requires collecting the data needed and analyzing the resulting data in some way to try to test our hypothesis. So it's time for the help of our 6 collection methods and 3 calculation methods. The collection methods are archival records, direct observation, documents, interviews, participant observation, and physical artifacts. The calculation methods are respectively description, catalogical aggregation, and direct interpretation. I will, of course, cover these parts in more detail for you in a moment. There are also a few reference books that I recommend to you, so if you need them, you can pause the video to take notes. Let's add something to what was being briefly described before. In a case study, nearly every aspect of the subject's life and history is analyzed to seek patterns and causes of behavior. Case studies can be used in various fields, including psychology, medicine, education, anthropology, political science, and social work. As we have already discussed the case study characteristics section, we will not go into detail here. And we have types. It has 6 types, 3 main types, and which we should choose in psychology research. The first is the collective case studies. These involve studying a group of individuals. Researchers might study a group of people in a certain setting or look at an entire community. The second is descriptive case studies. This involves studying with a descriptive theory. The subjects are then observed and the information gathered is compared to the pre-existing theory. And the third is explanatory case studies. These are often used to do casual investigations. In other words, researchers are interested in looking at the factors that may have caused certain things to occur. And we have exploratory case studies. These are sometimes used as a prelude to further more in-depth research. This allows researchers to gather more information before developing their research questions and hypotheses. And the next is the instrumental case studies. These occur when the individual group allows researchers to understand more than what is initially obvious to observers. And the last is intrinsic case studies. This type of case study is when the researcher has a personal interest in the case. The three main case study types often used are intrinsic, instrumental, and collective. Intrinsic case studies are useful for learning about unique cases. Instrumental case studies help look at an individual to learn more about a broader issue. And a collective case study can be useful for looking at several cases simultaneously. Well, as a psychology student, the type of case study that psychology researchers utilize depends on the unique characteristics of the situation as well as the case itself. We have already talked briefly about the method of data collection before, but each method contains various channels that you can look at it briefly, so we will not expand on the details of each method here. Although we have previously divided the data analysis methods into three simple categories, but as one of the key methods of qualitative research, I think there are commonalities between these qualitative research methods that do not require data computation. So I have decided to expand on them in detail as well. The first one is personal diagnosis. It's to provide your diagnosis and give the appropriate diagnostic and statistical manual code and explain how. And for cognitive behavioral approach is to explain how a cognitive behavioral therapist would approach treatment. And the third is humanistic approach is to describe a humanistic approach that could be used to treat your client, such as client-centered therapy. And we have psychoanalytic approach is to describe how a psychoanalytic therapist would view the client's problem. And the last one is pharmacological approach. If treatment primarily involves the use of medications, explain which medications were used and why. Well, after the main points of the case study method itself, let's look at an article on the use of the case study method to help you deepen your understanding of case studies. This is a psychological paper entitled Health Psychological Case Study of a High Intensity, Low Impact Physical Training Program, written by Stephen D. Edwards. I will start with the abstract, purpose of the study, research questions and conclusions, subject information, sampling methods, data collection, and computational methods to explain it to you. So what does this article examine using the case study method? Well, this case study reports on the health psychological evaluation of an integrated high-intensity, low-impact physical training program for a 32-year-old male accountancy teacher. The combined findings highlight the importance of a physical training program based on the client's personal preference. The client reported finding the program enjoyable, flexible, invigorating, and easily adaptable to the needs of a variety of individuals facing time and space constraints in their daily lives. With minimal innovation for greater complexity, control, and challenge, such programs may easily produce an enjoyable process experience. Regarding the objectives and the questions, the objective is to evaluate the health psychological effects of a high intensity, low impact training program. And the first question is what particular health psychologically oriented exercise program would be valuable for this particular client? And the second is the other is what particular components would be most suitable. So what sampling method was used to select what kind of subject? They also used the judgmental sampling method, chose a single participant, and the participant, well, as we introduced before, is an accounting teacher at a local private education college who wanted to develop a plan to improve his health, stress tolerance, and emotional state based on his physical characteristics and condition. His right knee was injured as a result of his running programming, and he has rare height and weight to the physiology of his right foot. Well, the qualitative question section is the description of the subject's experience recorded prior to the test. the experience recorded by the client during the consultation, and the assessment of the results of the post-test phrase 3 months after the test. Since our focus in this course is on qualitative research, I will focus more on the qualitative part of the presentation later in this paper. Regarding the data collection method, he used 3 methods. Generally speaking, he used mixed methods of quantitative and qualitative research, and single-person interview method, which subjects self-assessment and debriefing, and the last is questionnaire measurement method. On the method of data calculation, quantitative data were analyzed using the SPSS with specific reference to descriptive non-parametric statistics for psychophysiological and psychometric measures. The qualitative study collected subjects' subjective experiences and feelings about the project using a combination of interview methods and data analysis. Okay, I will also cover these sections in more detail later, and with regard to the summary section, let's finish by looking at how this paper determined its validity. Because a combination of measurement questionnaires with high reliability and validity was firstly, and secondly also ethical approval was obtained from universities and private clinics, and informed written consent was obtained from clients. Okay, let's see the qualitative questions content. Well, the high-intensity components include interval cycling, limited incline and sand running, and an adaptive version of Canadian Air Force 5BX exercises. The low-intensity component includes Pilates using Swiss balls, Alexander technique for posture assist, and Qigong for movement awareness, core strength and flexibility. A typical weekly program includes steady, stationary back rides interspersed with all-out speed burst, running, and 5BX exercises, along or in combination. Low-impact exercises involving walking, Qigong, or Pilates are performed in different patterns, usually along or after the high-intensity portion of the workout. Using the interview method, qualitative findings were made as to whether the subject's perceptions of the effectiveness and the reasonableness of the practice program sightings were in line with the assumptions and the expectations. And the validity of the qualitative research methods was further corroborated using subsequent quantitative search methods. Then I will introduce the data collection method. The current pre- and post-test case study design includes parallel and convergent design principles for the collection of quantitative and qualitative data in the form of psychometric tests and qualitative empirical descriptions. Quantitative data include psychological readings on HeartMath Wave 2 device, supplemented by responses to psychometric measures of health, resilience, and mood in the pre- and post-test phases. Qualitative data include descriptions of experiences recorded prior to the test, a diary of client's experiences during the counseling process, and an assessment of the results of the post-test phrase 3 months after the programming. As is typical of case studies, the communication, relationship, and training programming variables formed the larger, final, and complete component of the research intervention and were necessary and sufficient. Quantitative data were analyzed using SPS with specific reference to describe non-parametric statistics for psychophysiological and psychometric measures. Well, at the end of the paper presentation part, all in all, the article provides comprehensive quantitative, qualitative, empirical, and evaluate evidence of an effective short-term health psychology case study. Low-impact cross-training components, as noted by the client themselves. The programming can be adapted to suit the needs of a variety of individuals who face time and space constraints in their daily lives. In addition to exercise adherence, sustainability, and minimal risk of injury, such programs tend to be highly effective as they are adaptable, inherently enjoyable, and rewarding. By minimizing the needs of clients and coaches to adapt to greater complexity, control skills, and challenges, they can actually guarantee an enjoyable and meaningful area and flow experience.